My name is Dr. Michael Coe from Movement IQ Physical Therapy, and I'm going to show you how to use a foam roll to be able to release the adductors, and also I'm going to call the hip abductors, which also includes the IT band. So if I'm going to do the adductors, or adductors sometimes called, I'm going to do two different variations, or two different body positions. One is going to be here, where my hip's more of a neutral position. I'm doing the right leg, I'm getting the inner thigh. Knees pointed towards forward and front, and I'm going to roll forward and backwards here. Trying to get down to the knee joint line, get up as high as you can on the thigh if you can, and roll back and forth. Some variations you can do on here is roll forward and backwards. I can turn my foot just a little bit, maybe get more of the back side of that adductors. Or I can turn a little bit more inwards and get more of the front side of the adductors. You might get into a little bit of the quad. Now let's say I find a really bad spot, so this is pretty killer for me right here. I could either roll back and forth on that real tender point, where there's probably more adhesions, or I could stay right through there. I could roll in and out, right onto that adhesion. Another variation is I can move another joint. Instead of rolling in and out, which is a hip joint motion, hip internal external rotation, I could bend my knee into knee extension flexion back and forth to get a better release of those tissues. Variation number 2 for the adductors is going to be in a hip flexion position. So what I can do is 90 degrees hip flexion and also abducted, trying to get the inside of the thigh. I can roll forward and backwards now. Same rules apply. I can roll in and out. I can lift up the foot a little bit, get a little more rotation, get a different part of that muscle. It's a little bit hard to get the external rotation just because the foot is going to be on the ground. I could straighten out and turn a little bit more this way. Another variation is going to be finding a really bad spot, and I could knee extension, knee flexion back and forth. Spending more time on that area of more adhesions. Now the hip abductors is going to be, I'm going to mainly call it the IT band here, just because the IT band attaches to the tensor fasciae latae, the TFL. And it goes from the outer hip that connects from the pelvis down to just a little bit below the knee. So if I go here, I could roll forward and backwards. You see I have my foot down on the ground because I'm decreasing the amount of pressure onto the leg. What I can then do is then put both feet together up. That's more body pressure, body weight onto the foam roll, getting more pressure. Same rules apply. I can turn my foot to be able to get different angles of that IT band. I can find a really bad spot, and I could bend my knee back and forth. I can add a little rotation on that really bad spot there too. So try out those variations.